Hello, my name is Mr. R.G. Ebenezer. I will be presenting a lesson to you, NCV Level 2, Construction, Plant and Equipment. The subject we are going to cover today is First Aid. Unit 1, Identifying Emergency Situations. In this unit, we discuss how to identify various emergency situations at home or in the workplace. We will discuss appropriate behavior and responses such as the HHH and ABC principles, how to phone emergency services, and more. Our learning objectives are how to identify an emergency situation, what to do in case of injury, who would you contact for medical help. Emergency situations. What is an emergency situation? An emergency situation is one that requires immediate attention. I will repeat that. An emergency situation is one that requires immediate attention. These could be a matter of life or death. And some examples of emergency situations are as follows: fires, violence, whether it's domestic or public, accidents, and unexpected injuries like falling from a ladder or falling off a flight of stairs. In these situations, we must know who to call. Here are some of the emergency personnel you should know and have saved onto your mobile. You can consult your local telephone directories and program these numbers on your cell phone. The numbers you should have are fire and rescue, the paramedics, the police, and the ambulance services. Personal protective equipment, also known as PPE. When dealing with any kind of emergency medical situation, it is important to wear the appropriate protective equipment. When in the workplace emergency, there should be safety gear in the workplace. Safety gear such as helmets, earplugs, goggles, respirators or dust masks, gloves, overalls, and safety shoes. In the home, it is recommended that you keep such items. Items such as gloves, face masks, and overalls are some basic PPE that keeps you safe and lowers the risk of transmitted infections and injuries. So if you are in an emergency situation, you ask yourself the question, what do we do first? In an emergency situation, it can be difficult to keep calm and process the events that are taking place. Therefore, remember simple things that you can do to make a difference in these situations. The simple things are: help the injured person, treat, if necessary, the injured person. Also try and make them as comfortable as possible. You can call emergency services if needed. The manner of help and treatment will be discussed further in these slides. We will first discuss how to appropriately prioritize emergencies, then how to conduct yourself in an emergency situation. How to prioritize emergencies. In an emergency, we need to check a person's vital signs to determine priority. What are vital signs? These are the signs that show the body is living. For example, your heart rate, your pulse, and your breathing. In this regard, we have to prioritize injured people. There are three types of priorities. 1, highest priority. 2, second priority. And 3, lowest priority. When we speak about the highest priority, it's people needing immediate help and transport to hospital, generally people on the verge of death. When we talk of second priority, it's people who can wait an hour for help without risking their lives. And when we talk about the lowest priority, are people who can wait for help and transport, or those who are already dead. What is ABC? The ABC test helps you to determine roughly what the priority is. A is airways, B is breathing, and C is circulation. When we speak of airway, make sure there is no blockage in the throat or in the mouth. Breathing. Check the level of breathing, whether it's normal or not. So if a person is gasping for breath or the breath is staggered, there's something to watch out for. Circulation is checking for a pulse. If there is a pulse, then blood is circulating. We also prioritize people with the highest priority, second priority, and lowest priority. Highest priority. If the airway is blocked, breathing is irregular, and circulation is off, or the victim is bleeding. Second priority. People who have clear airways, good breathing, but have been injured in some or other manner, for example, burns, cuts, or broken bones. The lowest priority. If all vitals are stable, namely there is no blockage in the airway and breathing is good and circulation is good. The HHH principles. If you are the first on the scene, you must follow the following responses to accurately acquire information. The first H is hazard. Do not put yourself or the injured person in danger. For example, lifting an injured person off a live electrical cable could shock you or shock the injured person further. Hello. Greet injured person. If they respond, obtain information from them and keep them calm. Ask questions like, can I help you? How bad is the injury? These questions will keep the person engaged, and you can also determine how far or how much they have been injured. The third H is help. Get help from emergency services or trained professionals. Phoning emergency services. Remember to stay calm. Answer all questions asked by the operators. Phone the appropriate service. Although most services will redirect your call, it is safer and saves more time if you can call the correct emergency service. For example, in the case of a fire, phone the fire department. Give proper information. Don't say things like fire, 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 or help, 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 without providing the address of the incident, your name, what type of incident, how many people are injured, etc. By providing such information, it will help the services act accordingly. Emergency situations at home or in the workplace. Daily emergencies at home, or on your way home, or on your way from home, are car accidents, injuries to children or family members, choking while eating, injury due to unexpected violence. At the college or workplace, emergencies are breathing difficulties, injury due to equipment, electric shock, burns, and broken bones. How to identify second priority injuries? Burns. In the case of burns, there are first degree burns, second degree burns, and third degree burns. First degree burns are superficial and penetrate one layer of skin and can be identified by the redness of the skin or the area that is burnt is warm. Second degree burns generally penetrate two layers into the skin with visible blisters around the area. Third degree burns penetrate several layers of skin. Where the last layer is exposed, the skin is visibly charred. Broken bones or fractures. Minor fractures are your wrists, lower arms, and legs, known as closed fracture, as the injured area will be closed or sealed. Badly broken fractures are broken ribs. It could affect your breathing. Crushed pelvis area could be opened where bones are visible, also known as an open fracture. So there's two types of fractures, a closed fracture and an open fracture. You've got to remember that. Checking the pulse. When checking the pulse on the wrist, it is known as the radial pulse. So, when you're checking somebody's pulse on the wrist, it's here in line with the thumb, and that's where your pulse is, known as the radial pulse. How to check the pulse? Well, you count in a minute how many beats there are, and that will give you an indication of whether the pulse is correct or incorrect. I will explain to you further about how many beats there should be for each age group. When checking the pulse on the neck, it is known as the carotid pulse, mainly for people who have low blood pressure or shock. So the carotid pulse will be checked on the neck, on either side of the neck, on this side or on that side. It's known as the carotid pulse. In infants, when checking the pulse, it is known as the brachial pulse. That is on the inside of the upper arm. So on babies or infants, this is where we check for your pulse. Okay, it can be on either arm. So how do we determine how many beats there should be? So if you check the pulse is normal or abnormal, here are the following guidelines. In an adult that is 8 years and over, your beats should be 50 to 100 beats per minute. In a child that is 1 to 8 years old, it should be 80 to 100 beats per minute. In babies or infants under 1 year old, it should be 100 to 140 beats per minute. Here is a summary of what we've discussed so far. We look at danger. If there is a danger and it's safe to respond to the injured person, you check vital signs for blockages and injuries. If they are responsive, get as much information from the injured person as possible so you can relay that information to the emergency services. If there is a danger and the area is unsafe, for example, if there's a fire and there's gas bottles lying around, you identify and remove the hazards if possible. Remember not to endanger yourself or the injured person. and you call the emergency services as soon as possible. You keep treating the victim while you notify emergency services. Here are some of the learning activities that you can do, which should enable you to understand the section more and also remember for the next and upcoming examinations. In your own words, explain why you need to check somebody's ABC. How does one check someone's ABC? Write it in simple bullet points. Practice taking someone's pulse at the wrist. Write down what it is. And lastly, practice taking someone's pulse at the neck and write down what it is. Checking the pulse. Okay, in this section, I'm going to demonstrate to you on how to take the pulse because it is very important. So I'm going to call up one of my colleagues and I'm going to show you how to take a person's pulse so that if you are put in the situation, you'll know what to do. So I'd like to call my colleague up. All right, can you come closer to me? All right, so we said that checking the radial pulse is when you're checking the person's pulse on the wrist. So what we need to do is push the sleeve up slightly and you follow the thumb to this part of the wrist and you should be able to feel the beats. So as we take time, I'm going to ask my other colleague to just keep time on a minute and I want to count how many pulse beats there are. So are you ready, sir? Okay. And go. Okay, thank you. So, Mr. Mwabi is in perfect health. His pulse beats are 80 for the minute. All right? So if this gentleman had a problem and he had, let's say, high blood pressure, or if he was in shock, maybe after an injury, he sustained shock. So we need to check the carotid pulse. The carotid pulse, like we said, is on the neck. So on either side of the neck, we can feel the pulse beats here, right? You can check it on this side, or turn your head that way, or you can check it on this side, all right? You can check it on that part of the neck. Okay? So just like how we've taken the wrist pulse, we count a minute and we count how many beats there are in the minute. I'm not going to do that now. I'm sure that you can do that at home. All right? And then if in an infant or a baby, we said under a year old, we do the same. Thank you, Mr. Mwabi. You can take a seat. So on a baby's pulse, it is known as the brachial pulse, and it's checked there on a baby. And you use the same time unit to work out how many beats there are. For example, in a minute, you work out how many beats there are in 1 minute. Okay, after learning this aspect or this topic, there are frequently asked questions in most papers or most examinations. For example, the HHH principle is important. We all need to know what hazards and hello and can I help you means. Secondly, they will ask you questions like the ABC principles, which you've got to also understand what the ABC stands for. So you can mark that down. And then almost every time they will ask you about what is an emergency. And like we've discussed before, an emergency is a situation that requires immediate attention. They will also ask you, or they can ask you for different emergency services or their phone numbers, or what type of emergency services you would get. So we said fire and rescue, paramedics, police, ambulance. It could be other emergencies like sea rescue or whatever you come across in like daily life when it comes to rescue and emergency services. Personal protective equipment is also a very famous one. They will ask you to name types of personal protective equipment. So you think it's easy if you look at a person's body and you start from the top. So in order for you to protect your head, you need a helmet. In order for you to protect your eyes, you need goggles. Your ears, you need earplugs. So you start with the face and you go down the body. All right? If you're working at heights, remember that you've got to wear a safety harness. Okay? If you're wearing gloves, you're protecting your hands. And if you're wearing safety shoes, you protect your feet. It is also important to have overalls, because if you're working in a situation where there's flames or sparks, it could ignite your clothing. Your overalls, most of the time, would protect you from catching on fire. Okay, so we need to know about the 3 priorities. Remember, it was highest priority, second priority, and lowest priority. Those are also common questions that you could be asked. The HHH principles are important because they are also common questions in papers, so learn them. For example, H for hazard, H for hello, and H for help. You've got to know what it means. Okay, so you can also be asked emergency situations, what kind of emergency situations you would experience at home, and what kind you would experience at your college or at your place of work. You've got to know that, right? Burns, the 3 types of burns, like we said, 1st degree burns, 2nd degree burns, and 3rd degree burns are important. Fractures, you've got to know what are minor fractures and what are badly broken fractures. Remember, there's 2 types of fractures. One is a closed fracture, and the other one is an open fracture. Okay, so as far as I've demonstrated how to check the pulse, the question could be asked is, how many beats per minute for each age group? For example, adults, children, and babies. And we've got to know how many beats per minute are tolerated in those different age groups. So those are the frequently asked questions that you could be asked. Please study so that you would be ready for the upcoming examination.